All right. Well, welcome everyone. Again, good afternoon. My name is Courtney Sand, and I'm a licensed and board certified behavior analyst and a certified brain injury specialist trainer. I'm currently employed as the training and education coordinator with the Brain Injury Alliance of Iowa, where I've been for the past 6.5 years. So today's webinar is designed to help professionals like yourselves understand how to access, refer to, and collaborate with us with the Iowa Brain Injury Resource Network. So my hope is that by the end of today's webinar, you'll understand the history and mission of IBIRN and know the tools and resources available through the network and learn how to integrate the network into your own practice. So a little bit of data as we kind of dive into what IBIRN is and does, just a little information on brain injury. So every year, according to the Center for Disease Control, brain injury accounts for approximately 50,000 deaths, around 280,000 hospitalizations, 2.2 million emergency department visits, and every 23 seconds a brain injury occurs in the United States. With respect to Iowa specifically, there are approximately 600,000 Iowans living with long-term disabilities as a result of brain injury, and around 2,500 are hospitalized annually. The number one cause of falls in our state, the number one cause of brain injury in our state is falls, followed by motor vehicle accidents. So as most of you probably know, and our audiences with our webinars are often comprised of many, many professionals and also brain injury survivors and caregivers. So regardless of sort of the shoes that you fit into, you've no doubt come across the fact that our system is very, very complex to navigate, even for seasoned professionals. So I'm often reminded that if I ever am struggling to sort of keep up with the changes and understand the field, those with lived experience are struggling that much more. And so they're often feeling overwhelmed to the point of feeling paralyzed, not sure which direction to take, what to ask, because their brain injuries is a whole other kind of dictionary of terminology. You don't know what to ask for if you don't know what's on the menu. You don't know which words to use. Who do I call? Very overwhelming. Often leaves people feeling very frustrated, rightly so, hopeless, pessimistic, anxious. And this isn't just those with lived experiences. Professionals can feel that way as well. The folks that we serve with brain injury are often trapped in webs between the disability system, the aging system, substance use, criminal justice, mental health, with no system serving them best. And again, as a lot of you probably know, there is a lack of consistent and adequate funding for long-term supports. And then even for those who are eligible for funding, like the brain injury waiver in Iowa, for example, often will struggle to find providers in their areas. And there's a lot of turnover. So lots of different variables at play that make the system, again, very overwhelming. So that is one of the reasons why IBIRN exists. Let me go ahead and throw in, I see there's a question there. I'm going to go ahead and copy and paste. There you go. There's that link again, if anybody is just joining us and needs it. So as professionals, what's available to you as you serve individuals navigating life after brain injury? And so this leads us right into talking about what is IBIRN and what is available to you as professionals. So IBIRN stands for the Iowa Brain Injury Resource Network, which is a statewide system coordinated by us at the Brain Injury Alliance of Iowa in partnership with the Department of Health and Human Services. The mission of IBIRN is to ensure that Iowans impacted by brain injury, whether formally diagnosed or suspected, have access to information, support, and connection to services. And although this audience today is largely professionals, again, IBIRN is available. There are services that fall under IBIRN, services and supports that are available to those with lived experience as well, being survivors and caregivers. And so we want to meet you all where you're at and help you navigate. And our IBIRN rather, operates across multiple sectors, including but not limited to healthcare, education, behavioral health, corrections, aging services, and many more. Get a hold of my cursor here. So the first thing I want to talk about, one of the primary sort of services that we offer that I think we're probably known most for is called NERF for short, or Neural Resource Facilitation. It's worth noting that that name is in the process of being changed to Brain Injury Resource Facilitation. So if you hear the word BIRF or the acronym BIRF, it's one and the same. And so while this particular service is available to, again, those with lived experience, survivors and caregivers, friends and family, it's also available to you all as professionals. So some of the professionals that we often interact with, and we work with many, are employers. So maybe someone reaches out and they supervise someone with a brain injury, and they're looking to help them figure out what accommodations would be a best fit in helping set them up for success. Mental health therapists. Many of our clients are working with a therapist, and we can collaborate with them. Managed care organization case managers. So as people are trying to navigate what they're eligible for, trying to identify services. Often hospital social workers, when someone is approaching their discharge from the hospital and they're looking for an appropriate level of care. Teachers who have a kiddo in their classroom with a brain injury, and they're looking for, how do I serve this student best? What do I need to look out for? Rehab therapists, physical therapists, occupational therapists, speech therapists, cognitive therapists, probation officers, mobile crisis staff, you name it. So NERF, and I'm going to refer to it as NERF today, is free. And it's a phone-based service. It's always been phone-based, so it's not, since COVID, it's phone-based. It's always been over the phone. And again, it's designed for anyone in Iowa who's impacted by brain injury. So those are people that are navigating it, they're living it. Also people that are supporting those who are living it, which would be yourselves. It can feel a lot like, although that's not what we are, we're not social workers, we're not case managers, but it has a similar feel at the heart of what we do. And what I mean is we're there to connect whether it's professionals or individuals with brain injury or their caregivers, we are trying to connect to information and resources. We want to arm folks with the information that they need regarding their symptoms, what to expect, kind of normalizing and validating their experience, also helping make referrals. And that could look like somebody calling us and saying, ever since I sustained my brain injury, I've developed a seizure disorder and I can no longer drive. What are the transportation options in my county? Or, I'm seeing a therapist, or I'd like to, that understands the grief around sustaining a brain injury. Can you help me find one? I'd like to get a neuro psychological evaluation to better understand my symptoms. So you name it, we're trying to build bridges and link to other professionals. And I want to make it really clear that the purpose with working with other professionals is collaboration and working alongside you. We don't want to replace your services. Rather, we want to help educate and connect those dots and work together to serve this population in Iowa. We help folks identify possible funding opportunities, things like helping them figure out how to apply for Medicaid or disability, or maybe they were denied disability and need to understand, how do I appeal that? What are the next steps? I need a referral for an attorney that can help set me up for success the next time I apply. What is the brain injury waiver? How do I apply for that? So we're looking to connect with information, professionals, funding, so that the people that are living and navigating brain injury in Iowa have what they want and need and deserve, quite honestly, to live well with a brain injury. And then also opportunities like this around education, so webinars, support, and advocacy. So again, NERF is a huge part of what we do. It's important to note that proof or documentation of brain injury is not necessary. If again, if it's a formal diagnosis or if it's suspected and someone says, I fell I fell a few months ago and I never went to the ER, but ever since then I'm struggling with X. We don't need proof to serve someone. If they say, "Hey, I've sustained a brain injury," or a professional calls and says, "Hey, I suspect that this person may be struggling due to a past brain injury," we can support you. The timeline doesn't matter as far as if it's a new brain injury or if it's decades old. Life happens, things come up, and people need us. There's multiple ways to connect with us as far as a NERF referral. We can be called at the number there. And these are all on our website as well. We can be emailed. And then we also have an online referral form. And I'm going to go through and show you some screenshots of what that looks like. So on our website, which is biaia.org, if you go to Neuro Resource Facilitation, and then you go to online referral form, you're going to see this pop up. And there's kind of two parts to the page. The first part is, and if you are a professional and you are making a referral, you're going to fill this out according to your information. So, I'm Courtney Sand, IMA, and there's a drop-down menu. I'm a professional. Here's my work phone number. Here's my work email. I work, I am a case manager with so-and-so organization. I have someone on my caseload with a history of brain injury, so on and so forth. So you'd fill this out as far as your information as a professional. And again, if we have any survivors or caregivers in the audience, you would fill it out according to the hat that you wear, whether you are a survivor or caregiver. The bottom part of that page is the survivor information. So if you're a professional, the top part will be your contact information. The bottom will be just a little bit about the person that you're referring. So their first and last name, their county of residence, and then any documents that you want to upload. Again, we don't require any, so we don't need any for a NERF referral. And then you submit it. And this is a regionalized service according to county. So within 1 to 2 business days, the neuro resource facilitator that covers that county of residence will reach out to make initial contact and attempt to schedule an intake. The word intake sounds much more formal than it really is. I kind of think about it as a 2-part conversation. So whether I'm talking to a professional, a survivor, or a caregiver, the first part of that call, I always try to put people at ease and go, I know this is called an intake, but really it's just a conversation between you and I. The first part, I invite that person to share their story, whether it's theirs personally or it's a professional sharing on behalf of a client. Ask lots of questions, take lots of notes, and we complete in our system what's called a needs assessment. So we're looking at a lot of different variables about mental health, criminal justice involvement, transportation, what does their support network look like, all those kinds of things, trying to get kind of a baseline. And then the second part of that intake conversation is, okay, you've shared your story. Let me give you some hope. Do you know what NERF is? Most of the time, I'll tell you, most of the time people have no idea, and that's okay. They reach out to us knowing, okay, hey, I've gotten this business card. Somebody mentioned you. I know that you have the word brain injury in your title, but beyond that, I don't know what you guys do. And that's okay. Most of the time people reach out because things don't feel good. Life doesn't feel good. They know they need help. They don't even know what that looks like. I know I need help, but I don't even know what to ask for. And that's okay. So this is sort of where we start with folks. NERF is very person-centered. And I heard this quote years ago that I really like that describes what person-centered services should be. Nothing about me without me. So to the extent that that person is able, given their cognitive abilities, etc., this is about them. They're involved as much as they can be. And then if they're interested in NERF, we start setting goals together, both short-term and long-term. So I'll kind of try to paint a picture. Short term could be somebody who, if you've ever heard of Maslow's hierarchy of needs in like Psychology 101 in college or high school, at the very base, it's shaped like a pyramid. At the very base are things like food, water, security, shelter, the very basic things that humans deserve and need, right? Just to survive. And so often we'll get, sometimes we'll get folks that call in and they're homeless. They don't know where their next meal or shower is coming from. They don't take their meds regularly. They might not have a primary, care physician. So short term might be for that person. Let's find some immediate housing. Let's get you safe. Let's figure out where your next warm meal is coming from. Let's get you stable on your meds, those kinds of things. Long term could be, have you ever seen a neurologist? Are you looking for work? What about a support group or a therapist? So and every story is so unique, and those needs are unique as well. So we set both short and long-term needs. And then one of the backbone of NERF is follow-up. Every once in a while, we get somebody who reaches out and they'll say, I've heard of this thing called a brain injury waiver. Can you send me the application? And it might be one and done. They're not interested in anything else. Or can you send me your list of support groups? And it's one and done. Most of the time, though, once individuals start telling us their story and they hear about what NERF is and does and can provide, they often will say, absolutely. And openly often weep because they feel like, this is the first time I don't feel alone. I don't have to figure this out by myself. There's somebody out there that understands. So we don't want it, unless that's what someone wants. We don't want it to be here's a link or here's a handout on symptoms of brain injury. Good luck. No, we want this to be a relationship, a working relationship where we're regularly following up with people. And that can take the form of calls, emails, texting, which is something that was sort of born out of COVID. We've been working remotely for, it's hard to believe, over 5 years now. And one of the things we can do now, because we have our work cell phones, is send texts. And sometimes that's nice because it doesn't always need a phone call, or, maybe there's a quick question, or, hey, just wanted to check in and see how that meeting went, or what have you. We can still use snail mail and hop on a Zoom. And as far as follow-ups, it's as often or as little as is needed. For some, it might be every 3 months we're calling and just saying, hey, don't forget we're out here. How are things going? Just wanted to let you know I'm thinking of you. Don't hesitate to reach out. But for some who are going through quite a bit, it might be a few times a week. So again, that's that person-centered part of this, where we meet people where they're at, not only in their journey and what they're going through, but also with respect to the frequency and type of communication that they prefer. Moving on to some of the other components of IBIRN, one of those is what we're doing right now, professional education. So I've bulleted out a few different examples here. One is we've historically intermittently offered a certified brain injury specialist course and a brain injury fundamentals course. Those aren't offered regularly, but we have offered them in the past. Crisis intervention training. I personally really enjoy this one. It specifically targets first responders so EMS, police officers, that kind of thing, on understanding what they might encounter in their work out in the field as they interact with individuals who have sustained a brain injury. So that's always really rewarding. Free webinars. So our webinars, which I love, are free with free CEUs. And again, our requirements are that you attend 75% of the total duration, so you are present, and that you fill out the pre and post webinar knowledge check. And then you get free CEUs. And I usually try to schedule at least 2 a month. And if you haven't seen it, well, you've obviously registered for today's webinar, but if you go to our website, we have the next 6 months of webinars posted, and they all offer free CEUs, so take a look. We also have, for professionals specifically, an online training request form for in-services. So if you find the Iowa Brain Injury Resource Network, or the IBIRN tab on our website, and you go to training request form, you will find this. So I'm going to kind of walk you through what it looks like. So training requests are subject to availability and approval by our organization. Some training requests may be subject to a fee, including but not limited to mileage, meals, and lodging for in-person training and duration. And the contact for these. So if you're with an organization where you're starting to recognize, gosh, we serve a lot of people with brain injury, and our team would really benefit from like a brain injury 101, or hey, NERF sounds like an amazing service. Can you come do kind of an overview of what your organization offers? So as a professional, we ask for some information, first and last name, where you're from, contact information. And then we have a list here of commonly requested topics. And I'll just kind of go through those with you. Brain injury 101, that's a very popular one. Brain injuries, again, I named this one as well, an overview of our programs and services, very similar to the content of today's webinar. Brain injury screening. Symptom and behavior management, that's also a popular one. So we're serving individuals with brain injury. We recognize that. We've had a brain injury 101. What do we do now? We're dealing with this. We're seeing and trying to manage this symptom or this challenging behavior. Help. What tools are in our toolbox? An overview on brain injury and common intersections of brain injury, including mental health, substance misuse, child welfare, criminal justice. I mentioned CIT, or crisis intervention training, concussion protocol and management. Another popular one that I never get tired of talking about, ambiguous loss. This is a very specific kind of grief that's associated with brain injury. And so I have a version of that is about survivors and, or I'm sorry, not about survivors, but from their point of view and from the caregiver's point of view. Brain injury fundamentals and certified brain injury specialist course. So you fill out what you're interested in. If there's other, you can certainly do that. You would explain what you're looking for if it's not on that list. Are you looking for something that's virtual or in person? The location, date, maybe the date and time that you're kind of looking for, whether it's soon or months out. How much time do you have available? Expected number of attendees. And who is the training targeting? What kind of professionals will be in the audience? And then any other comments or questions. And most of the time, if what you're requesting is virtual and it's less than 1 to 2 hours, it's free. So, and I love that we can say that if you're like, what, we need some brain injury 101 and a little overview of what do you guys offer and what is NERF? Reach out, let us know, and we can work with you to set up those kinds of things for your organization. Another component that's available is educational materials. One of the big ones is the digital resource library on our website, and that's broken down into different tabs or subjects, including caregivers, children, so pediatric brain injury, concussion, COVID, employment, just general brain injury information, kind of 101 stuff, military resources, multi-occurring. So again, you can also think about the word intersections, so substance abuse, mental health, criminal justice, older adults, prevention, and stroke. I mentioned at the top of today's webinar that it's being recorded. Most of the time we get permission from our presenters to record our webinars. So usually within about a day or two, it is uploaded to our YouTube page. So that if you missed a part of it, if you want to share it, it lives there. We also do some micro webinars. That's exactly what they are. It's a little bitty micro webinar, and I would say anywhere between 5 to 10 minutes in length on little bite-sized topics. So those live in that library as well. Other resources. You can order free resources from us to share with the people that you serve, whether you're a paramedic and you hand them out in an ambulance, or you work in a group home and when people arrive, you want to make sure they have information about what we offer. Some of those resources that you can offer include our resource folders, a flyer on NERF, a brochure about our organization. We also have business cards. And then another thing that we have are wallet cards. And on the front, it says, I have had a brain injury. And there's a spot for emergency contact information, as well as tips and tricks, strategies on how to interact with someone with a brain injury. And a lot of our survivors carry these in their wallet or their purse. And if they're ever out in the community and they're struggling to communicate or just struggling in any way, and they can't find the words, they can show this to someone to sort of help. So if you're interested in any of those things, reach out to us at info@biaia.org to order. Support groups, one of the best parts of my job. So currently we have 5 in-person area-based support groups. And when I say area-based, that's exactly what they are, as opposed to like a statewide group. So we have one in Cedar Rapids, Davenport, Iowa City, Des Moines, and Waterloo. These are all listed on our website as far as who the contact person is and when and where they meet. All of these groups meet monthly, our in-person groups, and they are mixed. They're all mixed groups comprised of both survivors and caregivers. Two virtual options. We have a weekly statewide support group, and that sounds, I mean, it is exactly how it sounds. It's not like, oh, just people from this area. It's statewide, anybody in the state of Iowa. And then we have a monthly stroke specific support group as well. We also have a private or closed Facebook group for our caregivers, something that I started early on during COVID, recognizing that they needed a space of their own that was private where they could share their challenges and frustrations as well as their successes with each other without feeling like their loved one would have access to that kind of transparency. And it's now up to over 180 members, which is so exciting to see. So we do have that as well. And for anybody who's interested in joining that, that information is also on our support group link. It has the direct link on Facebook to be able to join. We have in-person events that we offer as well. We have our annual conference, usually in March, and it's usually 2 days in length. On a Thursday and Friday. Some years we've had a Wednesday component where we've had like a workshop or something that we've offered, but it's usually 2 days in March, generally in Des Moines. And we have speakers from all over the country, professionals, survivors, caregivers from all over the country, sometimes international. It is amazing. Not just saying that because I work with the Brain Injury Alliance of Iowa. It is a phenomenal conference in the Midwest. We also have our annual Brain Injury Day on the Hill. It's our advocacy day at the Capitol in Des Moines. Usually held in February. This last one was in March. Really powerful event, if you've not heard of it or been to it, where professionals working in the field of brain injury, advocates, and those with lived experience come together and we rally downstairs in the rotunda. Is that what it's called? Words are escaping me, of the Capitol. And we all wear, a t-shirt of the same color, and we make noise and we advocate for brain injury. And then folks that want to go upstairs and speak with legislators about their story and changes they would like to see. So very powerful event. And then workshops. COVID put put that on pause for a while, but we're starting to ramp up with in-person opportunities. We recently, let's see, today's the 28th of May. Earlier on this month, on the 7th, we had an in-person caregiver workshop and an in-person professional seminar scheduled in Sioux City. but due to registration numbers, we had to pivot to it being virtual, which worked out just fine. But we are hoping to, this fall, I'm hoping to attempt to host another in-person event. So watch for that on our events page. So lots of opportunities for in-person events as well. We also have a monthly newsletter. So IBIRN member sites receive monthly communication about services and supports, any updated resources that we want to highlight, news in the field of brain injury that's worth sharing, training opportunities, and upcoming events, whether it's webinars or our conference, highlighting those opportunities for folks to come together and to increase their capacity to serve this population. Our IBIRN directory. So the benefits of being listed, if you go to our website and you find IBIRN, there's a directory there, and you see it's a huge list of different organizations that are part of IBIRN. So the benefits of being listed here are one is increased visibility. So sites listed are featured on our website, allowing individuals, families, and professionals to easily find brain injury informed services in their region. Also, credibility and community. So this directory also identifies organizations as part of a trusted statewide network. And this reinforces your role as a brain injury responsive site, which naturally, that's what our clients are looking for. As I don't just want just a therapist, I should say but just a therapist. I want a therapist that understands my journey through a brain injury specific lens. Or, I want a neurologist, but I want one that really understands stroke, for example. So this reinforces your role and what your organization can provide with respect to brain injury. Other benefits of being listed in this directory, a clear referral pathway. So being in that directory means that professionals and community members know where to send individuals for screening and referral and services. Help shape the system. IBIRN directory sites contribute to a growing collaborative map of care that helps identify service deserts or areas where services are scarce, supports advocacy efforts, and drives improved access statewide. We have ways to stay connected. We have a lot of different ways to stay connected. We have 3 social media platforms that we try to regularly post on. So Facebook, LinkedIn, and Instagram. So those are ways of staying informed as far as, again, trying to highlight resources, upcoming events, news, and brain injury. So if you're not already following us, here's a way you can stay connected. And if you're interested in IBIRN, you can email us. And these are the same. This is the same email and the same phone number that we use for NERF, for those reaching out to access NERF. Let us know if you're interested.